I have been a chiropractor for the past 16 years. When I was 12, I had lower back pain, and my dad, he would always rub my back. I grew up riding horses, so at the end of a horse show, he was rubbing my back, and there was a chiropractor that was in our saddle clubs. I saw right away that in a short time my back pain went away. At the age of 16, I had a car accident, very sharp electrical back pain, and I went to my medical doctor and I was told to take 2 Tylenol, wait 2 weeks, if it still hurts, come back. And I remembered in the back of my mind that, Dr. Anderson, he really did a thorough exam on my back, and I went back in, and again, very good results. And at that point, I was definitely sold. This is what I want to do. I want to help people and help them with their spinal health, and look towards some wellness for them as well. In our office, we provide, as a core, we provide our chiropractic care, and since college we've gone to lots of seminars and training and added some advanced therapies that help our patients recover quicker. Also, we've added a pregnancy technique. In the last 10 years, I've worked with local midwives, and we have helped women be able to have shorter labor times and easier deliveries with the care we provide in that sense. We have other therapies as well, massage, and we have some laser therapy that helps speed tissue healing, and it helps really bring arthritic inflammation down. Another service that we have at our office is orthotic therapy. So that just helps balance people's biomechanics from the ground up, so that if there is a problem in their foot biomechanics, we want to correct that to take the load off their spine. And we have a weight loss program that we offer called Ideal Protein. It's a medical weight loss plan developed in Europe by a medical doctor, and we guide our patients through that as well.
I had the twins here in June, and they were very, very colicky. They would cry and cry and cry day and night. And we tried everything. We gave them all the medicines and drops and all that stuff, and nothing seemed to work. And I've never been to a chiropractor myself, but I said, let's give it a shot. So we give it a shot, and now the boys are nice and quiet, and everybody sleeps at night, and it's been a good experience. I would recommend Dr. Teresa to others. When your babies are crying, they do come out of joint, I guess, so to speak, and it's worked out very well for us.
When our new patients come into our office and they're greeted and asked to fill out a little bit of paperwork, so we have some history. From there, I will take them into an exam room, and we'll do a bit of a history, and I'll review the forms with them. The exam consists of orthopedic, neurological, and chiropractic tests that we do. So those orthopedic tests are designed to tell us what's causing their pain. The neurological tests basically just tell us if there's any nerve damage, and then the chiropractic tests specifically let us know if chiropractic can help.
Well, I started seeing Dr. Teresa for chiropractic care when I was pregnant with my daughter. I had been seeing another chiropractor, and I was not getting success with some relief of some hip symptoms that I was having. And Dr. Teresa was recommended to me by my midwife. She was very gentle. Her rooms were set up for pregnant women, so one of her tables accommodates baby bumps, and it was very comfortable to be adjusted by her, and I found great relief with the techniques that she used. When I was in labor, my midwife actually ended up calling Dr. Teresa, and she adjusted me, and I had Emma within an hour of her adjustment. So it was pretty amazing. Dr. Teresa was actually there for Emma's birth. She examined myself and my daughter right away. I would recommend Dr. Teresa. Others, in fact, I have to many people, and especially when I find out a friend is pregnant, I recommend that they come and see Dr. Teresa.
My biggest wow moment in chiropractic was about 13 years ago. There was a young girl, she was born at the Red Deer Hospital after a 40-hour labor, and in that labor There was some meconium, so that means the baby had her first bowel movement in the womb and had essentially got that in her lungs. So her lungs, she was having a hard time oxygenating. So she was on a respirator, a ventilator for 2 weeks. And the doctors continued to tell the parents that, you know, this young girl just is going downhill. We need you to grab your clergy and prepare for the worst, because there's no turnaround for this one. And the parents knew lots about chiropractic, so they got this little one adjusted. And the next day she was off the ventilator, breathing on her own, and turned around from there almost overnight after her first adjustment. And that's a wow, not just for chiropractic for me, but that was my first daughter that was born. Her name's Victoria, and she was really our miracle baby.
That is
Yeah.
wow.
It was a wow.